Hello, bonjour, que tout le monde, everyone. My name is Dr. Heather Morrison, and I'm so sorry I couldn't be there in person today, but I'm pleased to be able to join you virtually. I acknowledge that the land upon which we stand is unceded Mi'kmaq territory and that Epiquet is covered by the historic treaties of peace and friendship. I offer my respect to the Abequit and the Lennox Island Mi'kmaq First Nations people who have occupied this island for over 12,000 years, past, present, and future. I was so pleased when Henry Luyambaya, Executive Director of Chief Visionary Officer for New African Canadians, reached out on behalf of the Secretariat for the 2024 Global Mental Wellbeing and Substance Misuse Conference. Henry and I met at the World AIDS Day celebration hosted by Peers Alliance and Pride PEI in December 2023, where we discussed current and future opportunities for collaboration with the Chief Public Health Office. Many people are unaware about what our office really does. Even my own mother is sometimes surprised about the number of topics covered by the office and the Chief Public Health Office. Our mission is to promote and protect the health of all PEI residents. We are responsible for the administration of the Public Health Act and regulations, as well as oversight of related public health issues and events. So we really strive in what we're doing to improve the health of islanders by addressing the root causes of illness and injuries before they occur. Many factors, of course, have an influence on health. In addition to our individual genetics and lifestyle choices, where we are born, grow, live, work, and age also have an important influence on our health. These social and economic factors are known as the social determinants of health. The social determinants of health, such as age, sex, household income, physical and social environments, education, employment, and culture, strongly influence the health behaviors in a population and significantly impact disease burden. With everything we do at the Chief Public Health Office, of course, we have to keep the concept of health equity at the forefront of our minds. Some PEI residents have more opportunities to lead a healthier life as a result of their social determinants of health. These differences in health equity are unjust and modifiable. By reducing health inequalities, everyone has the same opportunities to be healthy, no matter who they are or where they live. Achieving health equity is a fundamental value of the Chief Public Health Office. We use evidence about the size and impacts of health inequalities to influence system and policy changes. Substance use is a reality, but we need to know that it has high costs and harms. In 2020, substance use cost PEI over $280 million, or $1,767 per person, and this is higher than the Canadian average. In terms of alcohol consumption, 18,000 island residents drank above Canada's lower risk drinking guidelines, and that was a number of years ago. And we know that island residents 15 years of age and older consume the equivalent of almost 500 standard drinks of alcohol per person per year. And half of PEI students, grades 7 to 12, reported using alcohol in the last 12 months. So this is a big impact, and that is just one substance, alcohol. And these costs and impacts come from lost productivity, healthcare costs, criminal justice costs, for example. And by far, the substance responsible for the highest cost is alcohol, at $131 million in a single year. Tobacco represents 25% of those costs, or $70 million. And then substances like opioids, stimulants, and other substances make up the remainder of those costs. And there are real human costs associated with this as well. I mean, we talk about the number of hospitalizations, emergency department visits, premature death, long-term and short-term disability, and other impacts on people and their loved ones. When we use all the evidence and the evidence-based tools we have in the toolkit, like health promotion, prevention, treatment, and harm reduction, we can reduce substance use-related harms, and we can help people to be healthy. And we just talked about some of the data, and we know that continuing to collect data is essential. And so this fall, we will be launching a public survey to better understand substance use in PEI. So I think we'll all keep our eyes peeled for that. In all areas of our work, collaboration is key to our collective success. We partner and consult with a diverse number of community groups, such as BIPOC Usher, Peers Alliance, and educational institutions like UPI and Holland College to amplify our impact and work together. Many of you are in the room today. These partnerships help us reach racially impacted communities and ensure our efforts are inclusive and equitable. We also value community support in all our initiatives. And these are initiatives from food safety programs, immunization programs, our needle exchange programs, our sexually transmitted and bloodborne infection programs, take-home naloxone, opioid replacement therapy, smoking cessation, alcohol reduction campaigns, and others. But it is together that we can drive meaningful change and improve health outcomes for all islanders by encouraging our communities to come together. Thank you for the opportunity to say a few things today and to participate virtually. I know our office and everyone here in the room is dedicated to fostering a healthier, more equitable PEI. And I hope we will all join together in that mission to create a healthier future for all residents of PEI. Thank you so much.